Today, in this video, we'll discuss about human metapneumovirus infections. Human metapneumovirus is a common respiratory virus that causes an upper and lower respiratory infection. It causes seasonal disease, usually in the winter and early spring. And the disease is similar to the respiratory syncytial virus and the flu infection. It's a leading cause of acute respiratory infection, and this virus was identified in 2001 by scientists in Netherlands. Discussing about the epidemiology of human metapneumovirus, it mostly affects the children who are age 5 or younger, and a small number of the children, around 5 to 16% of the infected children, they develop a lower respiratory tract infection such as pneumonia. Worldwide, models estimate that there were 14.2 million human metapneumovirus associated acute lower respiratory tract infections in children less than 5 years in 2018. And similarly, according to a recent study evaluating the population-based burden estimates of respiratory viral infection, showed that human metapneumovirus represented 9.8% of the disease. So, how common is human metapneumovirus infection? It is estimated that 10 to 12% of the respiratory illness in children are caused by a human metapneumovirus, and most of the cases are mild. 5 to 16% of the children they develop a lower respiratory tract infection like pneumonia. So this virus falls in the family of Pneumoviridae. It's a large enveloped, non-segmented, negative sense RNA virus. It has two subgroups, subgroup A and B, and there are two clades within each subgroups, clade A1, A2, clades B1 and B2. Talking about the pathogenesis, this virus replicates in the respiratory tract of infected person, and this receptor, integrin alpha V beta 1, facilitates the infection of the epithelial cells, and the infection leads to the mucus hyperproduction, hyperplasia of the respiratory epithelium, with resultant airway obstruction and hyperresponsiveness. Moreover, this infection increases the susceptibility to the development of bronchial asthma. Transmission usually occurs from person to person through the direct or close contact with the infected person. So the contact can be through the secretions from coughing or sneezing, through touching objects such as toys or doorknobs, or through touching and handshakes. So, who is at risk? This virus can affect people of all ages, but it mostly affects young children, elderly, and those who are immunocompromised. And peak age for the severe illness is between 6 months to 12 months. And the underlying structural lung diseases like COPD, bronchial asthma, or any other underlying lung disease can increase the severity of the disease. Incubation period is usually 5 to 9 days, and most of the patients they usually present with the mild symptoms like cough, running nose, nasal congestion, sore throat, fever, shortness of breath, and rash. In severe cases, there can be wheezing, difficulty in breathing, asthma flare-ups, and patient can also present with the secondary lower respiratory infections like bronchiolitis, bronchitis, pneumonia, and even ARDS. And in certain cases, patient can present with encephalitis as well. For the diagnosis, history and physical is very important. Investigations are also very important for the diagnosis. Usually, reverse transcriptase PCR is the preferred and the most sensitive and commonly used method for the diagnosis. It detects the viral genome. Similarly, immunofluorescence or enzyme immunoassays can be done to detect the viral antigens in the respiratory secretions. Similarly, viral cultures can be done in some labs. Serology can also be done to test for the presence of metapneumovirus reactive antibodies, and the definitive serologic diagnosis requires either seroconversion or at least a fourfold increase in the titer on serial samples. Chest X-ray shows non-specific findings like perihilar opacities, hyperinflation, atelectasis, and occasionally consolidation. Bronchoscopy can be helpful in getting the samples for the PCR and also for the viral culture. Differential diagnoses include the common infections like common cold, influenza, respiratory sensitive viral infection, and the COVID-19. Treatment for the mild human metapneumovirus infection is supportive care at home, and for the severe disease, patient requires admission, oxygen therapy, IV fluids, and sometimes inhaled corticosteroids or oral steroids. Currently, there is no specific antiviral therapy to treat this infection, and there's no vaccine to prevent this disease as well. And antibiotics are usually avoided. So the duration of the illness lasts from few days to a week, and the cough can take longer to go away. And most of the common complications include bronchiolitis, bronchitis, pneumonia, asthma and COPD flare-ups, otitis media, encephalitis, and in severe cases, ARDS as well. So the immunity after the infection, it usually provides some protection after the first infection, but the infection can occur again, but the subsequent infections are usually milder. For the prevention, people should avoid close contact with the people who are infected. Frequent hand washing practice should be done. Cough and sneeze should be covered, and people should stay at home when they're sick, and they should clean the possible contaminated surfaces like doorknobs or shared toys. They should avoid touching face, eyes, nose, or mouth, and they should not share the food or eating utensils like fork, spoon, or cups with others. So these are the references which we used while creating this video. Thank you for watching. Please subscribe to our channel for more videos.